Hi everybody, it's Dr. Eric Balkavich. I'm back for another edition of Thyroid Thursdays. Today we're going to talk about the last of the 6 primary hypothyroid patterns, and that being what's called thyroid resistance. And so in this situation, we're talking about the thyroid gland actually being resistant to the thyroid hormone. So the thyroid hormone we're making enough thyroid hormone, it's being converted to T3 in appropriate levels. The thyroid binding globulin levels aren't too high, too low. They're releasing plenty of free thyroid hormone to get to the cellular system, but for some reason, this thyroid reception of thyroid hormone to the thyroid receptor at the nucleus is not working. And so, unfortunately, in this situation, your doctor's going to run a TSH, T4. You may have finally talked your doctor into running a full or a comprehensive thyroid panel. Free T4 is normal, T3 uptake is normal, T3 is normal, free T3 is normal, reverse T3 is normal. Thyroid antibodies are negative, and this is one of those situations where your doctor doesn't really understand his thyroid physiology, doesn't run a full or comprehensive metabolic panel, and doesn't really take a good look at your full history. They may miss this pattern again. You will probably be diagnosed as being nuts, crazy, or lazy, and you may wind up on a mood-altering drug because you're stressed out. So, what are the things that may cause this receptor, this thyroid resistance, or problems with the thyroid hormone and the thyroid receptor? Well, high cortisol levels, high stress can create damage to the thyroid receptor and affect the binding. You can have chronic stress will drive up cortisol levels, and that'll do it. You can have that thyroid overconversion pattern could be doing it, and I've got too little thyroid binding globulin, and I'm getting too much free T3 produced. You can have high levels of homocysteine or inflammatory markers could compromise the conversion. You can have low levels of vitamin D and vitamin A, because vitamin D and vitamin A are critical for the docking and the reception that goes on at the nucleus of the cell. So these are the things that can drive and cause it. Ultimately, what we need to do is figure out what's going on here and address this. Unfortunately, if you run the full thyroid panel here, you're going to have hypothyroid symptoms, and yet all of your labs could be within the normal range. So this is a situation where you really need to be working with somebody who's knowledgeable about thyroid physiology, runs more than a TSH T4, runs more than just a thyroid panel when they're evaluating you. You have to have somebody who really does a good job with your history and takes a look at your full chemistry, not just a thyroid panel, and definitely not just a TSH and T4. I want to point out one other point. You could have 1, 2, 3, 4, or multiples of these hypothyroid patterns. And so it's not like you just get one. Typically, I'll have patients that have 2 or 3 of these patterns overlapping. And we haven't even talked about the most common cause of hypothyroidism yet. We'll do that in our next Thyroid Thursday, which is autoimmune thyroid conditions. But of these conditions, I typically see somebody who's got an autoimmune thyroid condition plus 1 or 2 of these other patterns going on at the same time. So I hope this helped. This is thyroid resistance, and again, a quick synopsis. All your lab levels will be normal if you run a full thyroid panel. And so you've got to look at some of the other markers. You've got to do a good job, look at your history. And we need to look at what's going on here to help you, okay? So, hope this helped. I'll talk to you next Thursday on our next Thyroid Thursday moment. If you have any questions, put them below the video and I'll get back to you. Take care.